Nearly 140 measles cases have been reported so far just this year. According to Health Canada, most cases were reported in Quebec, New Brunswick, and here in Ontario. Earlier this week, Peel Public Health reported a case of measles involving an international traveler who arrived at Pearson Airport. Officials say the individual may have exposed other passengers on a pair of Turkish Airlines flights on December 4th. Peel Public Health says anyone potentially infected should monitor for symptoms and contact a health provider if they experience any. Now, for more on this, I'm joined live by infectious diseases expert Dr. Isaac Bogoch. Thanks so much for being with us today.
My pleasure.
Now, we have just another case that's being reported, this one also linked to travel. I wonder if there's anything that stands out about it to you.
You know, there's this massive issue globally, a huge resurgence of measles. And of course, Canada is not immune. Now, most people in Canada are vaccinated and are immune to measles, or they've had an infection before the vaccine programs were rolled out and are immune to measles. The problem is we're going to see imported cases from time to time. It's inevitable. We can't control what happens outside of our country, but of course we can control what happens within our country. And it's our duty to ensure that vaccine rates are high enough such that when there is that imported case that's inevitable, we don't see any subsequent transmission. And unfortunately, with this big outbreak in New Brunswick, with many cases in Quebec and Ontario, we are seeing transmission within the country, and it's predominantly among people who are unvaccinated or under-vaccinated. So we still have a lot of work to do to ensure our rates are high enough such that we can prevent that spread.
Yeah, you know, we're at this time of year where we're kind of looking back at what happened in 2024, those kind of year-end recap stories. And I'm guessing that measles is really going to be a part of that. I wonder, just kind of in your day-to-day life, when we're talking to other people in your profession, is measles something that's coming up with you?
Unfortunately, it's coming up more and more in addition to other vaccine-preventable illnesses. For example, pertussis. We're seeing lots of cases of pertussis in Canada. And of course, it's a global issue, not just a local issue here in Canada. You know, it's really unfortunate that we're seeing the reemergence of vaccine-preventable illnesses because, as the name implies, these are vaccine preventable. And, you know, I think there's a lot that goes into this, including ensuring we build significant trust in public health programs, lowering all potential barriers to vaccinations, bringing vaccines to people, and ensuring that when people are presented with the option, you know, here's a vaccine for measles, mumps, rubella, pertussis, et cetera. You know, when people are presented with this, they have high quality information at their fingertips such that they make a smart decision and choose to get themselves or their families vaccinated. Because, you know, we are seeing more and more of these in Canada. And if we let our guard down, unfortunately, we'll see even more.
You know, looking stateside, we're looking at the new Trump administration coming into power not long from now. We see the influence of RFK Jr., who may be involved in some capacity, and the idea of a question mark surrounding vaccines making a lot of headlines there. I wonder if you're seeing that sort of an influence inching its way closer to us here.
Yeah, I mean, I think some of that mentality is encroaching on us in Canada. And listen, let's just be entirely transparent here. It's perfectly acceptable for people to have questions and to ask their physician or their nurse or their public health provider or their pharmacist questions about any medical product, including vaccines or medications. Of course, we should be curious, and of course, we want to look after ourselves and our families and our health and well-being. But you know, when it comes to things like routine childhood immunizations, like these studies have been present for decades and decades, and you know, we have decades of a track record of success of not only significantly reducing the risk of infection, reducing the risk of morbidity and mortality from these infections, and the safety profile with millions and millions of doses being administered, not just here in Canada, but elsewhere in the world with, you know, very good systems in place to track adverse events. So, you know, while, you know, obviously, like, as I mentioned, of course, people can have questions and it's important that they have all their concerns alleviated. I think it's also important to highlight, especially for these routine childhood immunizations, how important they are how they've done a remarkable job globally in terms of reducing morbidity and mortality from these infections, and how they have a very, very favorable safety profile.
And just quickly here, I want to get back to measles because we are getting into the holiday season, a lot of mixing and mingling with friends and family. How should we be protecting ourselves? What sort of things should we be looking out for?
Listen, measles is the most transmissible infection on the planet. If you're in a room and someone has an active case of measles and there's an unvaccinated person, there's an extraordinarily high probability that that unvaccinated person will get this infection. In fact, even if the infected person has left the room and has been out of the room for even a couple of hours, if an unvaccinated person enters that room, there's still a high probability that that person will get measles. It is very, very contagious. And again, the vaccine, while nothing is perfect, the vaccine does a remarkable job in protecting people from this infection.
Thanks. I appreciate that. Dr. Isaac Bogoch joining us on a Saturday. Thanks so much.
My pleasure.